So I'd like to invite everyone to do with me, actually, if you can. Okay, we're going to start by doing some breathing exercise first. So up to you whether you want to close your eyes or open your eyes, all that. Okay. We're going to start breathing first, actually. Okay, so just by the posture itself, because sometimes when we are working, we tend to slouch already. You slouch down your hands like that. So now, just consciously sit up straight. So just by sitting up straight, your spine is long, your breathing actually improves, you know, because when we are slouching all that, we are kind of cramping our lungs as well. So you're not breathing fully. So just by sitting up straight, your shoulders are back, your chest are in front. And just breathe normally first. So don't have to purposely make your breathing very, very long inhalation or very long exhalation. We're not doing yoga here. Okay, just breathe normally. But listen to your breath if you can. So you concentrate on your breath. As you inhale, so try to imagine in a way that you're drawing in all the air from your nose and then go all the way down to your abdominal, your tummy, and you consciously try to bloat it up. Then your chest also bloat it up. So if you want to feel the effect, you can just put one hand on your chest and one hand on your tummy. Then when you exhale, your tummy will actually go down first. Sorry, your chest will go down first, then your tummy. So you expel the air out from your nose. So inhale. Then you exhale. Inhale. Exhale. I want to introduce you to a humming bee breath. So same thing, inhale. But when you exhale, you make a kind of sound. So we go. So same thing, inhale. If you can, you push your tongue at the top of the palate. Then you exhale. Inhale again. Exhale. Inhale. So the humming thing is, I'm not sure whether you felt there's a vibration when you hum. So there are some other theories on sound theory or that helps in healing or that, because all this vibration theory, they were saying it actually sends a signal to your pituitary gland as well. So it actually helps you to stimulate it as well. But mainly what I'm trying to introduce is to like, just to take a break. And just by breathing itself, it actually helps you to calm down already. And if you can do some exercises or that at the same time, so we can do this as well. Like you can just follow your breathing. So everything you go with your breath. So it's easier. You don't have to remember, like try to remember so many things. So just by breathing in, then when you exhale, you tilt, bring your chin closer to your chest. Then you slowly go to your right hand side. Bring your right ear closer to your right shoulder. When you inhale at the back, you can open your mouth slightly, just naturally ajar. Then your left. So we're going in the clockwise direction. Second round. So if you can, just at your seat, do a little bit of stretching, neck rotation, all that. Then we reverse the other way. One more time. When your chin is near to your chest, inhale and bring your head straight. Blink a couple of times. Okay, I want to introduce you to some eye massages as well. Okay, because there are actually a lot of acupuncture points around our eye area. So like this picture here. So my idea is actually mainly to focus, is more like a maintenance, well-being kind of thing, because everything is so tired, so straining here already. So it's just like, you know, things need to flow, just like our blood, our nervous system, electrical impulses, everything need to flow in order to work well. So when there's something is blocked, you know it's not going to be good. And in TCM, in yoga, all that, we talk about the qi, we talk about the flow, all that. So things need to flow. So I'm not talking about treatment or something like that. It's just to use the acupuncture points by applying pressure to it to kind of release the tension there. That's all. Okay. So there are a few points that I'm going to ask you to press. So I'll just name them first. So inner corner of the eyes, which is Jingming. Then we go to the start of the eyebrow, 站足. Then follow the eyebrow, the center of the eyebrow, 鱼腰. The end of the eyebrow, 丝竹空. Outer corner of the eye, 通治疗. Then somewhere kind of like your eye back line there, 承气 and 四白. We're not using needles. We're using needles, then it's more precise. But because our finger is quite large, so when you press that, you kind of like press both of them at the same time already. So this is actually acupressure. So you either apply by using your fingers, or for more extreme kind of intensity, you can use your knuckle and press. So, you know, it's something like when you do your foot reflexology. When you press at the spot, and it's like very sore, the seng, that kind of feeling. So because it's your eye area, so please be gentle and use your fingers first. And you're pressing on the bone structure. You're not pressing on the eyeball, okay? Wash your hands, get a clean wipe or something like that. Just make sure your hands are clean. Okay, so you roughly know where's the spot. I will guide you with my voice. So actually, if you can, close your eyes, that would be better. So same thing we do with our breath. So you just position your fingers at the inner corner of the eyes first. Don't press, it's just to place it there. So when you inhale, press. Exhale, you release. Okay, so according to your breath, inhale, press. Exhale, release. Inhale, press. Exhale, release. Okay, so we travel to the start of our eyebrow, remember? Just place it there first. Inhale, press. Exhale, release. Inhale, press. Exhale, release. Inhale, press. Exhale, release. Inhale, press. Exhale, release. So you travel along the eyebrow, somewhere in the middle, the 鱼腰的. Inhale, press. Exhale, release. Inhale, press. Exhale, release. Inhale, press. Exhale, release. Inhale, press. Exhale, release. Okay, we move along to the end of the eyebrow. 十足空. So inhale, press. Exhale, release. Inhale, press. Exhale, release. Inhale, press. Exhale, release. Okay, travel to the outer corner of the eye. Same thing, inhale, press. Exhale, release. Inhale, press. Exhale, release. Inhale, press. Exhale, release. Inhale, press. Exhale, release. Okay, so somewhere along your eye bag now, so you can feel there's a bone there. It's part of the orbital wall here. Inhale, press. Exhale, release. Inhale, press. Exhale, release. Inhale, press. Exhale, release. So blink a couple of times first. Slowly, then you open your eyes. Do you feel that it's brighter actually? I actually feel that it's brighter. So sometimes it's just to release all this tension. And it also helps, you need to do to your face as well. If you have the time, you continue by the forehead because here also very tight. So just use your hands like that, place your fingers, and then you just drag your fingers along. So amount of pressure is actually up to you. And when you drag to the side, this is our Taiyang shape here, just give it a bit more pressure, press here. So, when you're young, last time when I feel giddy, all that, my mom will ask me to put medicated oil, Feng Yu, here. So it helps with the headaches. So eye strain headaches always kind of like comes together as well. And also here, just beside your nostril, this yin xiang is actually more for allergy, sinusitis, this kind of thing. And you notice that the nose and the eyes are always related. When you have the flu whatsoever, sinus, your eyes will also start to be teary. Because at the back, we have a canal that is connected as well. So sometimes you can do this just by applying pressure from the inner corner of the eyes, the Jingming, come down to the yin xiang. And this is a bit more intense. So you can just try it out and varies the intensity. And you can actually go on to the Taiyang also if you want to. Something like that as well. So for headaches, also at the back, there's a depression here. So this helps with the headaches. So if you can, you do both sides. And your fingers can also massage the top of your head at the same time as well. So everything is like related. And when you sit for too long, working all that, your neck also will have issues. So that's why you should also massage your neck. So you go by squeezing, letting go, slide, squeezing, letting go, slide, something like that. So you start from here, squeeze, then you go all the way down. So same thing, when you do left, you must do right, always must be balanced. And you can start from here and go through your shoulders and all the way down to your arms as well. I remember just now I was telling you about the fingers because all these nerve endings at the end of our fingertips. So everything, if you can, do one round and it's like 15 minutes like that. If you have the time. If you don't have the time, at least the 20 seconds rule, just look out, look far away, please. At least relax your eyes.